Oh wait. Hello everybody. Welcome to the Countless Vlogcast. My guest today is Rachel. How are you today, Rachel?
I'm good, thank you. Thank you for having me on.
So state your business and a little about yourself, please.
Well, I am a sole proprietor of Browns Point Counseling in Northeast Tacoma. It's in Washington State. I'm a one-man show. I contract with another provider in the area. There's a counselor shortage, so we're kind of ganging up with each other. Outside of our community mental health clinic, it can be difficult to find an affordable professional therapist. Yeah. So I own a small private practice, and I had just opened when COVID hit, and I lost most of everything.
Wow.
So I am rebuilding from scratch.
So when you first started, what inspired you to start your in the mental health field?
Well, I am a survivor of severe early childhood abuse and neglect. My mother has bipolar disorder with psychotic features. And it was a frightening situation for me and my siblings, and I was the youngest and smallest. And I spent most of my time hiding and being homeschooled because fear of the government due to my mom's psychosis. And it shaped me because, as we know, I'm a trauma therapist, so I work with adults with early childhood trauma. I kind of God pushed me that way, I think. And we know that these severe early childhood experiences actually change the body that you were born with. It changes the brain you were going to have. It changes your cells in your body. And so it's an unfortunate thing for any child to have to go through. But even more so, when you get into adulthood, if you don't have the emotional regulation skills and the interpersonal skills to be successful in a workplace or in school or in the community, you don't have much of a life.
So why do you think there's such a stigma to talk about mental health and like our issues? Because everybody has mental health problems, even if they don't realize it too. They may even if it's like something small like stress or like depression, stuff like that too.
Right.
Why do you think people don't talk about that kind of stuff?
Oh, well, I think because for a long time, we were told that made us different and sick, and we couldn't be trusted. So we had to be put in mental hospitals and away from people. And the way that they even still portrayed dissociative identity disorder in popular TV is stigmatizing because they don't portray it correctly. And so DID is, I don't know if you know that, dissociative identity disorder, where a lot of people think of multiple personality disorder. It's a trauma diagnosis. This is born out of severe early childhood trauma generally. The body, the mind protects itself, making you forget what is happening, making you forget what happened. You can get 20, 30, 40 years down the road, and all of a sudden, boom, you're talking to a therapist, memory comes back. That's me. I'm that therapist.
So how do you inspire your clients and people, like encourage people to come to you? How do you encourage them to like talk about, open up?
Well, so I think by the time that people are coming to me, a lot of times people have been through 5 therapists, maybe not been able to connect because their interpersonal skills, their ability to regulate their emotion and to be well enough to even connect with a mental health provider can be sometimes hard. Borderline personality disorder is something that's kind of born out of early childhood trauma as well. We see it a lot in women. And this section of this population has a very hard time finding therapists who want to treat it. I was told in grad school to stay away from borderline personality disorder. It was too hard. They were all high risk. I always wanted to commit suicide. And I just found it be one of the most fulfilling parts of my career is to be able to connect with these women who no therapist has been able to connect with. So I hear a lot, oh, this is going to work. You're a little goofy, and you get me. And yeah, I do. I get it. I lived it. I've come out of it, mostly average, I would say, but I'm able to connect with these people who have had the worst experiences, the most frightening experiences, given that it happened to them in childhood.
So it was like a moment you when you like discover like, oh my God, this is for me. I'm helping people out. Like, oh my God, like people are actually getting help and like becoming better. What was that like moment like for you? I'm like, what was that moment?
You know, I didn't know what I wanted to do. I was almost 28 years old when I started my bachelor's program. I had a GED. I dropped out of high school when I was 17 because I needed to get away. I needed to get out of my house. And at that time, I basically had maybe a 7th grade education because of the homeschool system that my mom had going. I wasn't going to graduate from high school, and it wasn't going to happen. So, you know, 10, 11 years after that, I was like, I've been a server for a long time. I was good at it. I was good at talking with people, and people seemed to like me. And I was good at listening to people and empathizing and, you know, just not trying to fix it for them. Just being there. Just being there. And I started my bachelor's program, and by the end of that, I was just like, I want to be with people. I want to be with people, and I want to help people. And 2 things I know real well, talking and mental illness, because I have a lot of experience with both. I did not talk a lot as a child. I wasn't talked to as a child a lot. So I tend to over talk now as an adult. It's one of the symptoms, one of the things that has stayed with me since then. Something I definitely have to work on. There's a good balance between talking and not talking. And those are the kind of the things, the personality things that a lot of people with early childhood trauma have to deal with. And so I had actually just found out I was a type 1 diabetic, had been misdiagnosed, and was pretty close to dying when I decided I wanted to be a counselor. And I was actually told I was too sick to go to grad school. And I mailed the application anyways. And it was last week of 2013 that I mailed that application off.
Wow, a lot of strength there.
You know, I was 90 pounds, sicker than any person could ever be from type 1 diabetes. I have a rare form of it. I've been misdiagnosed in a terrible healthcare system, lacking health insurance, as a lot of people did back in 2013, 2014 still. And I made it through. I made it through. Resilience is something I wish we could bottle and measure. I don't know what makes one person more resilient than the other. Sometimes I think it's support systems, and that being cash, resources, friends, family. Those things make us more resilient.
Yeah, definitely. Because it's like not a lot of time we do have to do it on our own too. We don't have to do it on our own. So we just think like, because like you said, a trauma is too. So we think we have to like, oh, I have to do something, get through my own, I have to hold it in. But you know, there's help out there too. Like, because you're a mental health professional too. Like, you know, firsthand, it's like you struggle through it and you help people out now too. So you know.
Yeah, we all struggle. And you know, we're not. None of us are without the ability to become severely mentally ill. We don't quite know what triggers some of these mental illness, like schizophrenia, bipolar disorder later in life. We still don't know. Some of it could be linked to early childhood trauma. We have no real understanding, as much as we'd like to say we do. So back to why and how it was just this. It just all came together. I had my interview at City University and was accepted, one of 22 people that started. 11 of us graduated. It is not an easy course to get through. You end up having to do therapy on other students and having therapy done on you, and it's grueling. It's grueling. The papers and the emotions and the late nights of trying to figure out what it is that makes people tick, what it is, you know, and writing these papers and just trying to really connect to the human experience.
So for like youth out there that struggle, like teenagers, adolescents, and like people in their 20s, what advice do you have for them? Like if they're like struggling or they think about going to see somebody, but they're still like hesitant to go.
Do it, but don't just trust anybody. You don't have to. There's a lot of counselors out there that are going to give you advice, and you don't need advice. Have you tried this? What about this? That's not what we're here for. We're here to hear you, listen to you, make sure you understand what you're going through is normal. What you're feeling is normal. Everybody feels that way, especially people having the experiences that you're having. And you'll know when you connect to a counselor. And look for one you connect to. Don't just keep going back when it doesn't feel right. Don't do it. Don't go back. It's torture. It's never going to feel right. Sometimes you're just not ready for counseling, and that feels different. But finding the right provider is extremely important. But a lot of people come to me and say, why haven't I had this therapy before? Well, because you didn't go to someone who was trained in this therapy. You come out of grad school with a basic understanding of CBT, which is cognitive behavioral therapy, and some other non-evidence-based mental health talk therapies. Well, I use evidence-based therapies, things that have been evaluated and have research to back them up. Dialectical behavior therapy and EMDR, eye movement desensitization and reprocessing. And these are tried and true treatments for trauma. Dialectical behavior therapy is a therapy born right out of Washington State, out of UW. Our own Marsha Lenehan. She's a professor there. She also has borderline personality disorder. And she created this to treat herself. And then found as she was doing research and getting more into it that it works. And it does. It does. It helps you change the way you look at your life, the way you look at yourself, the way you observe your body in time and space, and the way you observe others, and how that stimulus goes back and forth. And when we understand what's going on with our body, why my body tenses up when I hear this, and why I cry at the drop of a hat because that, it's easier to manage. So psychoeducation is a big thing. If you're not getting it, you should be. If you don't know why your body's doing the thing that it's doing, you need to ask your therapist why. And if they can't tell you, they need to find out.
Yeah, that's very inspiring too. Because people need to hear like the truth though. But like some people need to not have it sugar-coated, but they need to like have like softer tone. Like, oh, I don't need therapy. I don't need this too. But like just talk to somebody too. Sometimes you just need to talk to somebody. That's it. Sometimes you're just stressed out. Like you don't know why, but just talk to somebody. Let it out.
Right. And sometimes if you sit down with somebody who's trained to kind of hear things, they can help you suss out real fast what's going on. And a couple of times talking to them, you're feeling better, and you're able to just go tackle whatever it is you want to tackle. Don't let stress and depression or even severe mental illness get in your way of doing the things that you want to do. I was told, you're not going to do that. You have a GED. I didn't know about evolution due to my evangelical upbringing until I was 27 years old. I thought Adam rode dinosaurs. So I've come a long way now, almost 40. And I just started my practice. It's taken me this long to get through all the school. It's 7 years if you go straight through. And then internship and your clinical hours to even become fully licensed. I was working in a grueling community healthcare system that is not set up for people with disabilities. It's barely set up for able-bodied people, let alone a person with disabilities such as type 1 diabetes. And I had to leave. I had to jump ship this last December at the last minute. I didn't have a choice. And I was waiting on my license to get here, and then COVID hit. And I have 5 clients, which is not what I should be at. If we hadn't had this ridiculous virus hit the world and change us, change all of us really.
So in terms of the So in terms of the pandemic, what are some of the resources people can look for like talking to somebody online too? I know like online is like so big right now. So what are some of the resources?
Yes, online is great. And right now, a lot of therapists are doing online if you're not able to get out. There are places like BetterHelp and stuff. I'm not sure. I don't know a lot about those. If they take your insurance, if you have insurance and you have a copay and you only have a $20, $30 copay, use your insurance. I can't stress that enough. Don't go out of network. You don't need to. You need to call your insurance company. That's the place to start. You ask them what your benefits are for mental health, behavioral health. If you think you might need medication, what are your benefits for psychiatry? Or can your primary care doctor do some of that for you? And there's social workers. Generally, if you're with a managed care system like Kaiser, they have therapists, they have social workers, and they have psychiatrists. And the doctors are really well versed in depression and anxiety, post-traumatic stress disorder as well. The insurance companies are getting better at this too. They're getting better at having lines dedicated for mental health, helping people figure out where to go. If you're on a Medicaid system, like in Washington State, we have different managed systems for Medicaid. You have to go to a community health clinic generally. We only have a few choices here. It's kind of like very limited. There's a lot of these places, like the Valley Cities and the Greater Lakes, but there's only a few to choose from. And they're packed. They're packed to the fringe. And their therapists are worked to death for little pay and almost no gratitude from the employers. The patients are always very gracious and thankful that people are there to help them and understand. And that's the thing, is there's somebody out there who will understand what is going on, what is happening to you. There's nothing wrong with you. Something has happened to you. Sit down with somebody, figure out what it is. Find a creative solution. It doesn't have to stay this way.
Speaking of solutions, what are some ways like that they can improve the medical field, like individually and like professionals? Like I'm not sure how it works, but how can like it be improved in terms of helping people out?
Like the system?
Yeah, the system.
How can that be improved? Well, one thing is making sure that middle to low income students have access to these programs, because without going into $200,000 as a debt, I would have not gotten my degree. That is not viable. That is not a viable system. And the average student will say, I'm not going to go. Well, I have high-risk behaviors, so I spent $200,000 on school. Will I ever pay it back? Probably not. I get to be with people every day, and I get to help them feel better about where they came from, what has happened to them, and how to feel better and be part of their community without feeling awkward and out and just ick in your own skin. Nobody deserves to feel like that. So we need better access to education. And I'm not putting a self-critical statement for free education, but better access. That might mean free. It might mean a sliding scale tiered system. I don't know, but we need more access. More people need to be able to go into these medical fields, and not just the wealthy students or the well-to-do students, or the students whose parents were able to save because they had no crises and they just were able to, get going and they have a college fund. There's many, many people like me who ran from home, who are more than smart enough to be able to do these jobs, do these careers, but they won't, because they don't have the concept of being able to spend this type of money. And they'll stay away. They'll stay away. And also getting people with GEDs into programs such as this. I got lucky I was able to find a program that didn't use the GRE. Math is never going to be my subject. I don't have the mindset for it. And if I had only choices of schools that did the GRE, again, I wouldn't be sitting here.
So I know like a lot of people want to get into the field too. Like what kind of encouragement can you give to somebody like a high school graduate that's thinking about doing a medical field, even a doctor, you know, like, oh, I don't have the money, or like, okay, internships, what else?
Internships, talk to people. You know, therapists especially, they like to talk. So you could probably just, you know, call one and ask them if you could have 5 minutes of their time, and they would more than likely be willing to give it to you to ask you some questions. Counseling especially is not an easy job, especially with what I do. Being a trauma therapist, I do focus on the worst things that have ever happened to people, and I have heard the worst things. And I have to be able to deal with any secondary trauma and that might come my way. So you have to kind of have, I would say, this a personality for it, where you're able to suck in all this stuff, and sometimes it sits with you, and it can take you a day or two to shake it off. So you have the ability to shake it off. You don't walk around with it, with other people's stories tattooed on you. You have your own story, and you keep that separate. You use it to help educate yourself kind of on how they could feel the way that they feel, and kind of like you use it to kind of guide yourself, but you never mix yours with theirs. So you have to have very good boundaries, and be able to hear some, especially if you're doing counseling, just hear some things. You hear a lot of terrible things, because humans, as you know, humans can be so cruel, and but they can also be so wonderful at the same time
too, definitely.
And that's dialectical. That's basically what the word dialectical means. It means truth on both sides. The humans can be so awful, and they can be so beautiful at the same time, and that's confusing to the brain, because how could, right? And it just is. A lot of times you'll hear people hear me say, you get the reality that you have. You have to deal with the reality you have, not the one you wish for, not the one you want, not the one that sounds better. So what are you going to do about this reality? Find a solution. I'll get in the ditch with you. I'll sit with you for a few minutes. Well, with our picket signs, but then we're going to get out of the mud, because I'm not staying in it, and neither are you. There's a solution. There's things that you can control. There's things that you can't control. You know, and if you're a person that can kind of sit back and go, yeah, I can dig that, I could talk to people about that, then you might be a good counselor. If you have experience with drug and alcohol addiction, and you've come through that, and you're sober, and you're still struggling to find a career that might be good for you, drug and alcohol counseling would probably be a good career. Best drug and alcohol counselors ever are sober people who have dealt with drug and alcohol abuse in their life, and come out the other side, and can be a encouraging beacon to those wanting sobriety. So you kind of look at your own, I think, look at your own experience, right? Look at your morals and your values as well. Are you a healer, or are you a CEO? And that's okay. You know, counselors don't make a lot of money starting out. Or when they only have 5 clients. So you have to be prepared to not have any money for a while if you're going to pay your dues in community mental health, which you should. Everybody should. Wow. Everybody should do at least a small stint there, because if you've never been grown up in extreme poverty, you will not understand it really until you're immersed in it, when it's around you every day, and you are the one that is trying to find out how to find somebody housing when there's no housing, when there's just no vouchers. There's open apartments, no vouchers, no place to put this 85-year-old homeless woman, just left there to walk out the street. Can you deal with that and go home and sleep at night? Maybe you'll be a good counselor.
Yeah, that's big too, because a lot of people don't understand the struggles. So it's like if you're affluent and you come from like a nice neighborhood, you don't really understand the struggles. So it's like not to discourage anybody too, but like let somebody that can actually like understand their story and talk to them on their level, you know?
Well, yeah. And here's the thing: is there's always people who from the upper echelons that need a counselor that can understand people from upper echelons too. So think of your like Tony Soprano. He had to have a certain kind of therapist, right? So there's people that would not be able to sit in the room with me, and there's people that can't wait to get back into the room with me. I think that if you can empathize and you can refrain from judgment of the person in front of you, and you can help find creative solutions and not think that I'm in charge of this person and they have to do what I say. You're there to guide them. You're there to hold their hand. Well, not in COVID season now. Masks on 6 feet apart. Grab the rope. We'll walk together. That's what you're there for. You're not there to solve anybody's problems because you're not going to. They got to solve their own problems, even if they didn't make them. They got to solve them.
Yep.
We don't get to pick and choose.
Yeah, accountability is big.
Yeah, accountability, but nobody else is going to solve your problems. Your neighbor is not sitting around thinking about how to solve your problem, your mortgage. They're trying to solve their own problems, right? And so being real creative and being real intentional in figuring out what you have control over, what you don't have control over, because if you don't have control over it, leave it behind. Focus on something else, please. Because you're wearing yourself and everybody else out. And you're not focusing on what you can control. And there's a lot of things that people can control that they're missing. Because they want this need to control these things that it's not going to happen.
So what are some of the things that inspire you outside of like mental health and like your job? What are some of the things that inspire you on a daily basis?
What inspires me? Children inspire me. I think that every generation we just get better with love and kindness. And I see it in my daughter and her friends and my son and his friends. And I'm excited for these kids to come of age. So they inspire me. They inspire me to keep going. And our communities. Our communities inspire me. They deserve better than what they're getting right now. And that's everybody. Everybody deserves better, especially, again, it goes back to our kids. I asked today on the internet if everybody could just take a step back, take a deep breath into the nose, out through the mouth, and before we make any more decisions, that we think about the children that are being directly impacted by the adults that are making the choices that are being made today. In every single community, there are children being affected by your decisions. Look around you. Are those the decisions that you want them seeing you making? If not, take a step back, because we are teaching our children how to treat one another. And they're better than us, because they are proving to all of us adults that this is all nonsense. All this noise is nonsense. That without giving the idea that we are different or that we have a reason to dislike each other, they can just be together. And that's why children inspire me, because it's the adults, again, that give them the idea. You're different than Billy. You're different than her. We have a better car, so we're different than them. And you just got lucky. You won the sperm war. You came out of Romney instead of Roper. Main name. But it's luck of the draw. It's beautiful chaos is what the world is. Or Neil deGrasse Tyson tells us we're all made of the same stardust, and we're all made of the same stuff. We are of each other. And especially right now, if we could just all stop and think about what we're doing and what the children are seeing and how we're impacting their brains and their bodies for later adulthood, maybe we'd stop. Maybe we'd all just stop for a second.
Mm. Yeah. It's very inspiring and powerful.
That's my ask of everybody.
Yeah, that's what we need, though. Too, we need to remember the children too, because we want children ourselves too. Like we were in that innocent, like just like beings too, until we got like honestly like brainwashed. We got like told by society certain things instead of believing them and too. So, like the
world is terrorizing right now. Going from a deadly pandemic to riots all over our country. Protests and riots. This is a mixture of things, right? And necessary. These protests are absolutely necessary. And we have to think about the fear and that other people in the community might be under. People that aren't able to feel and get out there like that. They're scared. There's kids that are scared right now. They don't know what's going on. They don't understand why the adults aren't happy. And they're being fed hate. They're listening to hate all over, just hate. And again, if we could just all stop and treat each other well, nice, kindly. We're not the same, but we're not that different either. We're all made of stardust. We all come from the same place. We're all of each other. And if we could act as that, if we could be that, it wouldn't be so terrorizing out in the world, I don't think.
That's one thing you for coming on too, and so inspiring and powerful.
Thank you.
This end here with some powerful words. Don't just end it with the power of speech though. This end with like some powerful words of inspiration, and then let people know like words of encouragement too. So.
There's a lot of crazy stuff going out in the world. Just be kind. Be kind to the person next to you. Be kind to your family. Be kind to your friends. Kindness goes a long way. You'd be surprised. Just be kind. I don't know how inspiring that is, but right now, I think kindness would go a long way. Loving, gentle kindness.
So where can people find you at? Like Facebook, Instagram, where can people find you at?
Well, you can find me at Rachel Bastida on Facebook. And email is bouncepointcounseling@outlook.com. I'm always willing to answer educational questions from interns and such like that on trauma, dialectical behavior therapy, those things. Anybody that has questions about schools, how to get going in schools. I don't give therapy through email or online. You have to be a person in Washington State and go through the regular channels, which would be through Browns Point Counseling, 206-313-3989. And we can get you set up with an appointment if you're here in Washington State and Tacoma or Federal Way, Auburn, Browns Point area. Thank you so much for having me on.
Thank you for coming on too. It's been very inspirational too. So,
thank you.
We are the change that we want to be. So,
You do have to be the change you want to be.
Yep. And here you go. So thank you for watching, everybody. And thank you for being on, Rachel. I appreciate you.
Bye. Thanks so much.
All righty. Thank you.
Peace.
All right. Have a good night. All right, guys. Thank you for watching. This has been the Countless Vlogcast, episode 13. Rachel, a medical professional out of Seattle, Washington. Thank you for watching and have a good night. Be sure to watch this after on Facebook on my page, Justin Rich. Have a good night, guys.